Hello there, a very good morning and welcome to another edition of the Talk of the Town. Joining us this morning is Dr. Chamal Sanjeewa. He is the chairman of the Professionals Forum of Physicians on Medical and Civil Rights. Dr. Chamal Sanjeewa, now, the people in Sri Lanka are the main concern of the professionals, of the media, because while we are the media and you are professionals in the health sector, we all together are people in this country, and it is our fellow brothers and sisters who are dying as a result of these substandard medicine. What can the people do in this situation? I know there is very little, but do you have maybe something creative that the people can do to really push these people in power who are either turning a blind eye to these incidents of fraud, corruption, and malpractice, or the people who are engaged in these acts of fraud, corruption, and malpractice?
Yeah, the few weeks ago, actually, I request public to observe any of the parliamentary members has come to your rural hospital and observe it. I asked as a question, have you ever seen there are 225 MPs in the parliament? Have you ever seen any one of them has gone to their district and the regional or the base hospital on that their district and seen whether are there any pitfalls or any the drug shortage, nothing. But unfortunately, we haven't seen. From the Minister of Health, we never see he has gone to Colombo or Kandy Hospital and have a face-to-face discussion with the public. That is why the secretaries, DGs, ministers, they are holding the press conference in the ministry auditorium with AC, but they don't touch the ground level people. So I request public to make some professional forum or with as a public community groups and meet your MPs, meet to all the local bodies and those who work in the provincial level and push them, pressure them to take this issue to the parliament as well as because the people have rights to talk about on behalf of their living because this is a matter with the living and the death.
Mm-hmm.
Because we can't give because of this scenario and there's now this a completely mismanaged system, so we can't guarantee about the majority of the incidents happen in the hospital sector. We don't know at any point there might be something can happen. So the public's awareness and also the public's worry is that we have to justify it. So then we wait for overcoming that thing rather than putting the press conference and say there's no low quality drugs, no substandard drugs, like thing, and the people will laugh at them. So rather than what they have to do is they have to make a roadmap for the 2024, and that is why I mentioned still they haven't made any roadmap to the 2024. So that 2024 might be worse than this scenario.
So, Dr. Chamal Sanjeewa, you're saying that they need to present a proper plan, a proper plan that makes sense to the general public if we are to move forward from this situation. Thank you very much, Dr. Chamal Sanjeewa, chairman of the Professionals Forum of Physicians on Medical and Civil Rights, for joining us.